of blood products used in treatment, and the health department insists that it is effective. But today a specialist in haemophilia said that the purification doesn't always work. The director of Newcastle's Haemophilia Centre called the spread of AIDS among his patients a developing disaster that should have been prevented.
It is quite simply, according to the doctors, the greatest challenge this century. And though the numbers with the disease are small at present, the overall prospects are chilling. In Britain so far, the death rate has been over 100% over 2 years. And there is no cure, but there may be methods of prevention. In response to that challenge, the largest conference on the subject in Britain is meeting in Newcastle upon Tyne, the first directed mainly to health workers, the people who will meet the brunt of the now seemingly inevitable spread of AIDS to come. Gavin Esler reports.
They are the best of British experts on our most dangerous new disease. Virus specialists, venereal disease professors, haemophilia workers, psychologists, and those who monitor the spread of epidemics for the government. No other medical conference with a format of fairly staid lectures could ever hope to attract even a flicker of public interest. But this conference, like AIDS itself, is different.
Even in this most sober and distinguished of gatherings, the figures are simply frightening. 20,000 people in Britain exposed to the AIDS virus already, 20,000 new cases expected this year alone. 287 people who've contracted the disease AIDS, half of whom have already died. Some of the victims have been women, and no sign of the disease abating.
The star of the show is Paul Volberding from San Francisco General Hospital. He has treated more AIDS cases than anyone else in the world, 600 in all. Volberding brought good news of a sort. After rising steeply among the city's homosexual community, AIDS in San Francisco appears to have peaked at 65 new cases every month for the past 6 months.
It's got to be the most complex disease that we've tried to come to grips with, and it's caused by a virus that we don't understand very well yet. And our track record of developing drugs to inhibit viruses in the past has not been so good that we should be optimistic. So we're not pessimistic, but we're not expecting a major breakthrough soon.
Even some areas where progress has been made have been called into question. Plasma donated to the blood transfusion service is now routinely screened for traces of AIDS. That system is working well. But special blood concentrates, which stop haemophiliacs from bleeding to death, are now also heat-treated to kill off the AIDS virus. But new evidence produced today suggests there are problems. In 4 cases, none in Britain so far, haemophiliacs have been shown to have the virus after using the supposedly safe blood-clotting agents. The heat treatment is not foolproof. Dr. Peter Jones presented that research to the conference, and he called today for haemophiliacs who develop AIDS as a result of such treatment to be compensated by the government in the same way as whooping cough victims.
These people have been injured by the treatment which doctors like myself have had to prescribe for them, and that they do deserve compensation. Watching the spread of this disease in the community of my patients and their families is like watching a slow ebb of van. It's the engulfing of an entire generation of people by a new disease, and all that we can do for them at the moment is to follow them up, and what I'm asking for now is to try to help them in more practical ways.
All the Newcastle conference experts predict one major and potentially disastrous area of growth for AIDS among junkies. Bill Nellis of the Standing Conference on Drug Abuse told a fringe meeting that half the junkies in one area of Edinburgh, where syringes are hard to come by, are positive on the AIDS virus test because they're forced to share unhygienic needles. He believes openly providing addicts with clean syringes will cut down on AIDS, although it will be controversial.
There are perhaps 50,000 individuals that are at risk of AIDS because they are injecting drugs, and they need to be more aware of the dangers, and far more pragmatic consideration needs to be given towards providing them with the tools with which to reduce their risk. People need to take a much harder look at syringe availability.
Until the predicted increase in AIDS among junkies happens, homosexual men will continue to make up the majority of cases. The gay charity, the Terence Higgins Trust, has encouraged homosexuals to change their lifestyle and sexual habits. This spring, the government is to spend £2 million on an AIDS information campaign to dispel some of the myths and help prevent the disease.
I think the bleak outlook is you have a sexually transmitted disease which causes a persisting and persistent infectious carrier state, and one which you can only control at the moment in the absence of vaccine by behavioral and educational methods.
With what we know about AIDS now, the epidemic can be stopped. It's a sexually transmitted disease, and if we can educate the people that are spreading the virus, I think we can dramatically slow the epidemic down, and I think you have a better chance to do that than we've had.
You have to take a microbiological view, not a moral view. If you start taking a moral view, nobody listens to you. All you can say is people can't do without sex. Make it microbiologically safe.
The Newcastle conference proved there's now a growing AIDS industry, everything from machines that screen to disposable and totally safe methods of sampling blood. But beyond the sales talk, the hard facts are these. No prospect of a vaccine in the foreseeable future, and no prospect of checking the spread of AIDS unless somehow, as a community, we can change sexual habits.
So it seems at least the good news is that Britain is on the right track, spending our money on information, on prevention where there is no cure. Apart from that, nearly everything else at this conference was remarkably gloomy. As one public health expert put it, as far as AIDS in Britain is concerned, you ain't seen nothing yet.